folks. Welcome to another edition of the EasyConnectMD.com video podcast minute. Gabe Farias, Dr. Daniel Kellum, CEO of Kellum Family Medicine, Kellum Physician Partners. Of course, this video podcast is presented by EasyConnectMD.com. Visit EasyConnectMD.com, enter the coupon code GETWELL29.95. You can see a provider in a timely fashion, especially now with questions, with concerns that you have. If you feel bad, if you have some emergent needs, EasyConnectMD.com, enter the coupon code GETWELL29.95 is the visit. Normal cost is $39.95. This gets you $10 off of your visit. Dr. Kellum, we have a special guest here.
I know, Gabe, I'm excited.
And he's scared. Is he a little scared?
I think he's going to be fine.
You know, in the continuation of the great students and the partnership that we have with the University of the Incarnate Word, we've got Evan Wright, who is a third-year medical student at UIW. Evan, welcome to the EasyConnectMD.com video podcast minute. Now you know you've made it, my friend. You know you've made it.
Thank you for having me. It's a pleasure to be here.
All right. Dr. Kellum, to say that COVID is dominating everything, not just medical news, but life, is the understatement of all understatements. The Delta variant is out there. So much information out there that people are trying to gather. You know, just what are your first thoughts right now on the wave that we're going through as it pertains to COVID-19?
You know, it's been kind of difficult. It's reminiscent of where we were in July of last year when we started to see these spikes. And, you know, we were all hoping we were past it with the vaccine. But this particular surge has been a little bit bothersome. What bothers me, I think, more than anything about this is the effect that it's having on some pediatric population. So before, kids were relatively resistant and they did well. But we're seeing higher increases of hospitalization with kids in the ICUs. And so that I think bothers me, because some of these kids are not well within the range of vaccination yet, at least for the approval of that. And so it's a little bit tough. And you add that going back to school with masks and mask mandates and whatnot. And you know our position on things, or at least my position on games. I'm not one to believe in mandates per se. However, I think in situations like this, it should be something that parents really consider, because it is the one way we can protect kids in school. And you know, we try to take this outside of the political realm and keep it within medicine. And when you look at medicine itself, for me, I have my kids wearing masks in school, because that is the one way that I can protect my 10-year-old right now, because he's not necessarily in the age range to get a vaccine. And we know that most kids do well, and death is not really the issue. And that's not, I think, for all of us, that really should be the thing that's taken off the table, because that doesn't happen in a very big percentage of individuals. But it's the true illness, and it's the severity of illness, and then the complications that may come from that are the things that we need to really worry about. I don't think that this wave is going to carry on too long. You know, my hope is that within the next couple of weeks or month, we'll start to see a decline in that. But we have to be diligent about that. And I would encourage parents to really look at that from that standpoint, because we are seeing kids getting sicker now, and as well as the unvaccinated individuals. And that's unfortunate, because, you know, a lot of people have particular positions on why they should or should not. But if we could encourage them, or at least give them this information, so 89 to 90% of the people in the hospitals and the ICU are unvaccinated individuals, and it's truly that prevalent within that population, and people are getting sick. Death is not as much, so we haven't seen a real rise in death rates associated with that, but certainly, you know, long-term complications that come associated with that are things that can be there, and it takes a toll on individuals. And so, you know, a simple vaccine that we know is safe and is effective can protect against that. You know, I would hope and pray that people really relook at that a little bit to see if maybe that's a consideration that they would open up to, and maybe get protected with the vaccine.
Evan, you've worked and done some research on COVID-19. What are some of the things that you found with the vaccine? And I'm assuming, Dr. Kellum, I mean, this is the dumbest assumption ever, because you know that it's the truth. The fact that the FDA approved the Pfizer vaccine recently, hopefully that will encourage more folks to get the vaccine. But Evan, what have you found in some of the research that you've done in COVID-19?
So with some of the research that I've done with the vaccine, I looked at a lot of things like the adverse events and the incidents that things like that happen, what kind of adverse events are related to some of the vaccines. And when it comes to the mRNA vaccine, so the Pfizer and the Moderna, we're looking at really small incidences of things like myocarditis, pericarditis, but in the realms of like 0.0004% incidence rate, which myocarditis can also be a complication of COVID-19, and it happens at a much higher incidence rate than that.
So just to break that down, I have a better shot of going outside, getting hit by a bus, surviving that, and a month later going out and getting hit by a bus again.
Correct.
Than having the complications that you're talking about with the vaccine.
Yes, and probably even still a higher chance of then
getting
recovering
hit
from
by
that
a
second
bus,
one
getting hit
and
by
then
a bus
going
again.
a
Yes.
third time.
Okay, there you go.
And that's, to that, that's really important, because that's, safety has been the thing that
Yeah.
a lot of people have had some apprehension with, and certainly hopefully getting this full approval through the FDA limits some of the reticence that they've had for the vaccine. However, some people still really persist on the safety of the data because it was rushed, quote unquote. And we know that it went fast, and that was by a necessity to save lives for sure. But the depth of study in terms of the millions and millions, hundreds of millions of people that got the vaccine, I think really speaks to what Evan is talking about. We squeezed a lot of those adverse effects out when you talk about that heavy of a population penetration with the vaccine. And what we're seeing now, and I would ask Evan to look at that as well, but what we're seeing now is that the vaccines are doing their job. People that get the vaccine still get it, but we've always known that efficacy was not 100%, meaning that you still had that chance. We know that severe disease and death is mitigated to a great degree. It's never zero, but it's certainly improved. And we're really seeing the vaccines do their job. People that get it, that have been vaccinated, are not going into the hospital. It relegates it off into, to just a bad summer cold. And that's not to say some people don't get sicker than that, but it's really done its job from my perspective, practically. And what is your thought about where you saw things initially statistically?
So with the initial statistics, it looked like with the mRNA vaccines, very effective at preventing COVID-19 infection, so somewhere in the realm of the 94 to 95% effective rate. Now, I was looking at some data on how that changes over time, and so there is some indication that starts to drop off a bit as time goes on, which is why it's looking like some of the new guidelines might be getting a booster at around the 8-month mark. But what we're seeing is that the CDC is saying you can kind of hold off on that a bit because the protection against the bad infections, the pneumonias that go to the hospital and things like that, even at that 8-month mark, are still somewhere in the 93 to 97% of being effective.
And where Evan is referencing that is that there's a study in Israel. So Israel's the comparative value that I think we use in a lot of things. And so, that population is about 80+% vaccinated. And what they've seen is in the past anyway, is a real decline in active diseases. But what they've seen lately is a rise in new cases to the tune of about 7,000 to 10,000 a day. So we know that, at least presumptively, that for the Delta variant, there's a little bit of limitation with that. And what their speculation is that with the booster, as you said, that could be better. And it's interesting because there's some thought about whether or not the period that we gave the vaccine initially, that 21-day or 28-day, if we would have spread it out a little bit, that it may have created a little longer immunity. I think that's neither here nor there. We know that it's worked. We know that it's done its job. We know that it saved lives. But I do think that there's going to be guidance coming out with boosters, and we'll be speaking to that in future podcasts for our patients and for the community to let them know what that guidance is and when to come in. We haven't got that cleared out yet, other than immunocompromised people and high-risk people. They're certainly out there, but we're looking at, as we always do, to the Department of Health, to the state of Texas, so that we can get distribution of product, and then we'll be back in the community, hopefully partnering with Incarnate Word to be able to deliver vaccines as we need it. But it's definitely something that I think is coming in the future.
What do you guys think about, because again, I'm not a medicine guy, but all this information is just phenomenal. What do you tell the folks that got the one-shot vaccine, the Johnson & Johnson vaccine? Because they're still doing studies, I'm sure. They're still looking at a possible second shot. What are you hearing? What can you tell folks that have gotten the Johnson & Johnson? And right now, initially, their efficacy on safety right now versus what could potentially come down.
Similar safety to severe disease and death. I mean,
Yeah.
we're seeing that whole truth.
And I think that's an important point.
And that's the most important
Yeah.
point, because that's the whole thing about this. But we're seeing an increased risk of catching it, because we knew that the efficacy was in the 70s%, 73 to 75, I believe that was. And so we knew that they had a greater chance of getting it. Again, and I will tell you, in terms of where that booster is, it's going to be a question of where they're at. If it's a second J&J shot, or whether or not there will be some combination with the messenger RNA and the Johnson & Johnson to try to increase efficacy between the both. So, we'll look to the CDC for that, because I think they'll comb through the data, give us some idea of what we need to do, and then we can kind of go from there and see. But what I would say to that is talk to your physician, get on easyconnectmd.com, come into the office, and we will sit down and give you every information that we know about that, so that we can try to clarify some of this, because there's a lot of noise coming to people and a lot of information with a little bit of fear, and that's always a recipe for disaster, in my opinion. And so as we're able to kind of break it down into nuts and bolts and to things that people truly understand, because a lot of this is just over our head when the CDC and others start talking, but we can make it practical for you. And I think once we do that and we can really understand the risks and needs, I think that's really important. The other part I would like to say to that, and where I hope that they come through, is when people have gotten COVID. So the discount of the natural immunity, I think, has been way too big. And so someone who has gotten the vaccine and then gotten COVID, their need for a booster is probably not going to be enough. That's just me saying this. It's not studies that are looking at that. But we know that the benefit of natural immunity is huge. And so there's going to be that part of the equation as well. And so there's a lot still to be deciphered when that comes to come. And again, as we get that information, we'll be happy to deliver that in the way that we can.
But one of the things that again, just me looking at it from the outside in, if I got this in March of 2020, okay, fast forward a year and a half later, you're still letting people, well, I had it back in March of 2020, I'm fine. That's
had the vaccine?
Had COVID-19. They should still get a vaccine, correct?
There's debate about that, Gabe. I will tell you, when you look across the thought leaders in terms of public health and epidemiology, when you look at natural immunity, there is a lot of sustainability in people that have had it, even at that point, that can still be protected. Now, whether or not that protection is adequate enough, we have not seen a lot of reinfections going on in people that have had natural immunity. And Evan, I don't know, you can speak to any studies that you've looked to that, but we have not really seen that to be the case.
Yeah.
And that's where, again, I think the discount for natural immunity has been kind of tough.
But it can't hurt, though.
It can't hurt.
Yes.
Right.
Okay.
But, in medicine, we're always looking for necessity, risk versus benefits. And so, anytime you introduce something into the body, there may be a risk, albeit small, that we're seeing with these vaccines. And so we always want to make sure we're parsing through information, because there's got to be an absolute benefit, and mitigated risk when we do that. But again, in someone like that, I think that's an individual situation depending on their circumstances.
And talk to their doctor, talk to the provider. Yeah.
But what have you seen with that, or at least what have you heard?
So I've seen some things. There was a presentation that the CDC, I think, released about a week ago, and I was combing through that, and there was a slide that kind of was comparing the immunity from vaccines versus immunity from someone who acquired COVID-19. And it seems like that antibody response is still present at the 8, 10, 12-month range. But beyond that is where that starts to kind of decline.
Yeah, and I think what we'll see with that, and this gets a little more into the weeds, I will tell you, but when you look at vaccine antibodies versus natural immunity, what you get is a little more broad-based coverage, so coverage against multiple viral strains, as opposed to the one that you're getting with the vaccine alone. And it goes back to SARS-CoV-1 back in 2004. You still see antibodies present.
Which is when they started working on this technology,
right. Which is why we always hold the premise that it's not rushed. But in those individuals, they seem to have a little more broad-based and long-lasting immunity. And I think it's going to be very similar to this. But time, again, is going to tell. And I think that's just a matter of keeping conversations open, keeping an open mind, which I think is very important. And then as information comes out, we certainly will read that to people. But it's one of those things that I think my hope is that people don't have such a hard and fast stance, that they look at the evolution of this thing, because it has evolved over the year and a half, and that way we can certainly make decisions based on what's happening in the moment.
Evan, just to tie it back, of course, Evan Wright's a student at the University. He's a medical student, third-year medical student at the University of the Incarnate Word School of Osteopathic Medicine there at Brook City base. To tie it back to your research and to a conversation we had earlier in the first segment of the broadcast, which is communication, how important is it for people to not listen to their high school buddies, and say, that's not, you shouldn't do it, but listening to people who know and understand science, the Dr. Kellums of the world? How important is communication and people asking the right questions to not just for the sake of asking them, but asking them to the right people?
Right, and I would say that that's something that I found to be paramount, and equally as paramount, I think, is as the medical care providers to listen to your patients, listen to what their concerns are, so that you can address those with them. Because if someone comes in and they have a concern about something, it's something that should be treated with the seriousness that any patient concern should be treated with.
Absolutely.
And you're learning that here with Kellum, with Dr. Kellum, aren't you? So,
absolutely.
Well, good deal. Well, guys, a great conversation. We could talk for hours on this, but appreciate the dialogue, appreciate the conversation. And Dr. Kellum, information is key. Ask questions. If you haven't gotten the vaccine, ask questions. Again, one of the platforms that you can ask a question if you can't make it into a doctor's office is easyconnectmd.com. It's the sponsor of this broadcast. It's a telemedicine platform that's under the Kellum family, or powered by Kellum Family Medicine and Kellum Physician Partners. Use the coupon code GETWELL, $29.95, to see a provider to talk about any type of medical need that you have. Dr. Kellum, information is so important.
It is, and one other thing I'd like to add with that is that if you choose not to get the vaccine, and we understand, don't feel like you have to be separated from us as your healthcare provider. If you get symptoms, come in and get tested, because we're looking at early prophylactic treatments with the Regeneron antibody treatment. So the Regeneron antibody was the thing President Trump got at
when he got better,
Walter Reed, where he got better. Now they're offering that in a simple, easy injection, and we're looking to get access to that as we speak. And so there's a lot of opportunity for treatment that's coming on that's cutting edge, in my opinion. And so what we're saying, or at least what I'm trying to say, is for our patients and for the community as a whole, if you get sick and you choose not to get the vaccine, there's no judgment with us. We like to give out knowledge, but people's decisions are people's decisions. But if you feel bad and you're getting fever, let us test you, let us help you, because we don't want you to go down that path to hospitalization. If we can intervene early, I think it's going to make a huge difference for people.
Wow.
So
I think you came up with our topic for our next podcast, and that's
go.
the treatments of COVID, which again is it's evolving every day.
Absolutely.
Every day we're getting more information and more quality treatments for this deadly disease. So, guys, thank you so very much. Evan Wright from the University of Incarnate Word School of Osteopathic Medicine, a third-year student. Dr. Danny Kellum, CEO of Kellum Physician Partners. I'm Gabe Faria, COO of Kellum Physician Partners. Remember, EasyConnectMD.com is the sponsor of this podcast. Please visit it. If you have any medical needs, $29.95 is the cost to see a licensed medical provider if you enter the coupon code GETWELL. For Dr. Kellum, for Evan, I'm Gabe Fadias. Folks, stay healthy.
This past weekend, I was struggling, not feeling so good. I had a lot of nasal and chest congestion. I really didn't want to go to an urgent care clinic because I don't want to be in a crowded waiting room. I heard about telemedicine, and someone recommended EasyConnectMD.com, and it was so effortless. After a few easy steps, I was on with the doctor. All I had to do was enter some basic information, list my symptoms, then I gave them my preferred pharmacy, and before I knew it, I was talking to a provider. Within an hour, I was on my way to the pharmacy picking up my prescriptions. EasyConnectMD.com was so simple to use, and after this experience, I don't think I'll ever visit another urgent care clinic again.